Well, the British Prime Minister is now into his second day of isolation, having tested positive for the coronavirus. According to the Business Secretary, the Prime Minister continues to lead Britain's response to the coronavirus from the front. Those were his words, from the front. And he went on to say there are no gaps in government, clearly presenting the message here to the British people that despite the fact that not only the Prime Minister has tested positive for the coronavirus, but the Health Secretary has tested positive, that the Chief Medical Officer of England is now in isolation because he has symptoms of the virus, and as well the announcement on Saturday that the Secretary of State for Scotland, now also having signs of the coronavirus, is himself isolating. But the government here doubling down on its efforts to combat what is happening, offering help to businesses to prevent them from going easily into insolvency during this period. Those were new financial support measures. Also putting in place today a testing facility for health service workers, setting up at a car park in a theme park on the outskirts of London, so those NHS, National Health Service workers, can get tested. But the government is taking heat, being criticised by a leading medical journal in the UK, The Lancet, the editor-in-chief there, writing that the government's response has been a disaster, that it has failed because it hasn't followed the World Health Organization guidelines of test, test, test. The statistics today, the death rate is climbing at a higher rate than yesterday, up 34%. 1,019 people now have died through the coronavirus in the UK. That is a noticeable increase over Friday. These numbers, however, are what the government was expecting. They were expecting a rapid rise. Their message continues to be to the public, stay at home unless it's absolutely necessary to go out.
Clearly, there has been a big increase in deaths today, and every death is tragic. And of course, we need to do everything that we can to ensure that we don't lose the lives of loved ones to this terrible virus. But as Sir Patrick Vallance, I think the Chief Scientific Advisor to the government, said recently, if we can keep deaths below 20,000, we will have done very well in this epidemic. It's early at the moment, and the scientists who are working with government to model what we can expect are, of course, adjusting their predictions now as we start to see the actuality of the epidemic in the UK.
Amid a paralyzing pandemic, husband and wife Niall Barrett and Janika Dimmel have found a purpose: feed as many NHS staff as they possibly can.
11:25, we're okay for now.
Their days have become a flurry of activity, loading up meals from home.
You got something for us, sir?
Then driving by local restaurants, like this Italian cafe, eager to donate hot meals or sell in bulk to make a little profit at a time when business is at a standstill.
Okay. All right, my friend, thank you so much.
Thank you.
Rushing from place to place, the couple tells us it all started just over a week ago, when a friend and nurse asked the couple to drop off some snacks.
Started off with 20 pizzas, which we brought, and now we're delivering over 300 meals a day, so it's gone a bit crazy.
Inspired by the response, the pair set up a crowdfunding account. 9 days later, they'd raised almost $45,000 for their group, called Critical NHS. And now they deliver hundreds of meals twice a day, and more volunteers have joined. Antoine Truteau admits there are risks, but they're necessary. The meals go to the staff at St. George Hospital. As one of only 4 trauma centres in London, it's preparing for an expected surge in COVID-19 cases.
So we're not being allowed to film on hospital grounds, and that's because restrictions are changing by the hour. What's key is to keep NHS workers from getting exposed. As the hospitals become overwhelmed, they have one message to the public: stay home, save lives.
Outside the main entrance, Amjad Shahan, CEO of St. George Hospital Charity, tells us many nurses don't have the time to buy food.
Obviously, the hospital is busy, staff are busy. It's a difficult time for the country, but everyone's doing their best. We're lucky to have an amazing NHS. St. George's is an incredible hospital, and we're really appreciative for all the support that we're getting here.
We also run into first-year medical student Millie Clemens, who's come by to drop off some sandwiches.
It is scary to think that had I been 4 years older, then I would be part of the doctors that are tackling this now. So I just want to help in any way that I can.
For many here, that means supporting the country's frontline medical staff as they brace for a battle sure to challenge even the most prepared. Salma Abdulaziz, CNN, London.